Good afternoon, everyone. Thank you for joining today's pre-application webinar for the 2026 SBIRT funding opportunity. My name is Shakayla Terry, and I'm one of the project officers for this grant program. Before we begin, I'd like to address a few housekeeping items for today's pre-application webinar. Please note that all participants will remain muted during the presentation to minimize background noise. We do have a lot of content to review for you today, so we will not have time to answer any questions. If you have any questions that are not answered during our presentation, please email us at the resource mailbox and we'll share all of our email information at the end of the webinar. This webinar will also be recorded and any materials or follow-up information will be shared after the session on samhsa.gov. Thank you all for joining today. So, as a mission reminder, the Substance Abuse and Mental Health Services Administration leads public health and service delivery efforts that treat mental illness, especially serious mental illness, prevent substance abuse and addiction, and provide treatments and supports to foster recovery while ensuring access and better treatment outcomes for all. The purpose of this webinar is to review the NOFO requirements as well as the application requirements. There are some questions that may not be addressed until after awards are made, such as the specific data and reporting requirements. So today we will cover federal award information, program description, eligible applicants, the applications guide, merit review, project narrative and application components, required attachments, required activities, allowable activities, data collection and reporting, as well as reporting requirements and other expectations. So for this funding opportunity, we have up to $7.9 million. For this award, we will be awarding 8 total, with at least 2 awards being made to tribal and tribal organizations pending sufficient application volume for these groups. This award will be projected for up to 5 years at up to $995,000 per year, with the anticipated start date no later than September the 30th of this year, and applications are due by Monday, July 13th. This funding opportunity seeks proposals from established healthcare organizations that possess robust operational capacity and well-developed partnerships, enabling them to serve young people ages 12 to 21 and screen them for substance use disorder. Applications should demonstrate the capacity to rapidly implement evidence-based development to the appropriate expert services for substance use identification and early intervention, utilizing existing clinical workflows, care coordination models, and established community partnerships. Applicants serving pediatric populations are encouraged to describe how SBIRT will be aligned with ongoing primary care and chronic disease management activities, including family-centered approaches and referral pathways to support the continuity of care. SBIRT services are intended to be integrated into routine care delivery and may be implemented within primary care settings that provide ongoing care to children and adolescents, including those with chronic or complex health conditions. For the purpose of this funding opportunity, pediatric providers, include providers, serving youth ages 12 to 21. And so your organization will be expected to deliver early screening and intervention for alcohol and drug use for all patients beginning at the age of 12, as well as providing timely referrals to more intensive treatment for those who have substance use disorder. Eligible applicants are states and territories, including the District of Columbia, political subdivisions of states, Indian tribes or tribal organizations, health facilities or programs operated by or in accordance with a contract or award with the Indian Health Service, and other public or private nonprofit entities. Please note that any recipients who receive SBIRT funding in fiscal year 2022 and fiscal year 2023 under the NOFO TI 21008 and NOFO TI 24010 are not eligible to apply for this funding opportunity. Cost sharing is not required for this program. And now we will dive into the SAMHSA strategic priorities. As you develop your project, it is important to make sure it aligns with SAMHSA's broader strategic priorities, including recovery, innovation, data, gold standard science, and access to high quality services for all. These priorities also align with the Make America Healthy Again Commission. In addition to the priorities listed here, applicants should review Section I of the application guide for any other expectations that must be considered during project development. For this award, recipients are required to follow these principles when they are consistent with the authority scope and activities of the award. The first principle is evidence-based and outcome-focused practices. Your project should use evidence-based and evidence-informed approaches. You should also establish measurable performance goals, use data to monitor outcomes, and use that information to support continuous improvement and accountability. The second principle is program integrity and fiscal stewardship. Recipients must administer funds in accordance with applicable federal statutes, regulations, and award conditions. This includes maintaining strong internal controls and ensuring taxpayer dollars are used efficiently while preventing waste, fraud, and abuse. The third principle is partnership and coordination. Depending on the purpose and authorization of the program, recipients should coordinate with appropriate partners. This may include law enforcement, juvenile and criminal justice systems, civil courts, civil commitment programs, crisis services such as the 988 Crisis and Suicide Hotline, state and local agencies, tribal and territorial partners, and community organizations. Projects should not be developed in isolation, and applicants should consider the partnerships needed to engage individuals in prevention, treatment, and support services while tailoring services to meet the needs of the community. These are additional objectives that recipients should advance when their funding programs are authorized to support them. SAMHSA strategic priorities also include additional objectives that recipients should advance when their programs are authorized to do so. The first objective is prevention and substance use and addiction. Recipients should support strategies that prevent substance misuse and addiction, particularly among youth. This includes recognizing the connection between early substance use and long-term health consequences, including chronic disease, mental illness, and addiction. The second objective is treatment for serious mental illness and complex needs. Programs should serve individuals with the most serious and complex behavioral health needs, including individuals with serious mental illness. The focus should be improved on access to evidence-based treatment. The third objective is recovery, sobriety, and self-sufficiency. Recipients should provide support and treatment that help individuals achieve long-term recovery, maintain sobriety, build independence, and improve their abilities to function in work, family, and daily life responsibilities. The fourth objective is parental rights and family engagement. Programs serving children and youth should engage and empower parents and caregivers in decisions related to the care and support that their children receive. This includes protecting parental rights and ensuring transparency. Recipients must demonstrate ongoing compliance with these principles and objectives throughout the life of the award. This applies to program design, implementation, reporting and evaluation. If funding activities do not meaningfully align with the applicable requirements, SAMHSA may require corrective action, additional reporting, or other enforcement actions consistent with federal grant regulations and the terms and conditions of the award. On this slide, I want to point out to you the fiscal year 2026 SAMHSA NOFO application guide. As you are developing your application, it is important that you review each section of the guide carefully. This guide provides step-by-step instructions for key parts of the application process, including the overall grant application process, registration requirements, required attachments, and budget preparation. I want to emphasize that the application guide should be used alongside the NOFO. The NOFO gives you the program-specific requirements, while the application guide provides additional instructions that apply to the application process more broadly. Please pay close attention to the details in the guide, including formatting requirements, submission instructions, required documents, and deadlines. Before applicants can submit the application, there are several registration requirements that must be completed. First, you must have a SAM.gov account. SAM.gov registration can take several weeks, so you should begin that process as early as possible. You must also have a grants.gov account. This account is required to submit the application package, so applicants should make sure that the account is active and that appropriate staff have access. In addition, applicants must register in ERA Commons. This process can also take several weeks, so please allow enough time to resolve any issues. And please note that SAMHSA staff cannot troubleshoot any of system issues, so we have the contact information provided at the end of the presentation for each help desk. So now I will begin with the merit review for each of the project narrative components. The project narrative is where you will describe the project in detail and respond directly to merit review criteria. The narrative is divided into 5 sections, and each section has a specific point value and approximate page expectation. Applicants should use these sections as a guide for organizing their responses and making sure all required information is addressed. Section A is population of focus and statement of need, worth up to 20 points and approximately 1 page. Applicants should clearly describe who they intend to serve and why the project is needed. Applications who propose populations of focus include more than 50% youth, aged 12 to 21, with chronic or complex health conditions, including pediatric care practices, pediatric health systems, school-based settings, and other youth-serving organizations may receive up to 20 points. Applicants should describe how SBIRT will be aligned with ongoing primary care and chronic disease management activities, including family-centered approaches and referral pathways that support the continuity of care. Section B is proposed implementation approach, worth 30 points and approximately 5 pages. This is the largest section, so applicants should provide a clear and detailed explanation of how the project will be implemented. If more than 50% of your population will be the youth of focus, you must provide specific information about how you plan to service that population. Your organization must also describe how its proposed implementation approach will address SAMHSA priorities. Section C is proposed evidence-based, adapted, or community-defined evidence services and practices, which is worth 25 points and approximately 2 pages. Applicants should describe the services or practices they plan to use and explain how these approaches are appropriate for the population and community being served. Section D is the staff and organizational experience, which is worth 15 points and approximately 1 page. Applicants should describe the experience and capacity of organization and key staff who will carry out the project. And Section E is data collection and performance management, which is worth 10 points and approximately 1 page. And applicants should explain how they will collect data, measure performance, and use information to monitor progress. We encourage you to pay close attention to the point values. The goal is to provide a complete, well-organized response that clearly addresses each review criteria. All attachments discussed during this segment are required. However, we will highlight the most prevalent attachments for your consideration. More information can be found on pages 22 through 24 of the NOFO. Applicants are required to include the attachments listed here as part of their application package. Attachment 1 is letters of commitment. These letters should document involvement and commitment of key partners or organizations that will support the proposed project. They include identifying at least one experienced and credentialed substance use treatment provider organization, in addition to a list of all direct service provider organizations that will partner in the project, including the applicant agency if it is a service provider organization. These letters of commitment should come from direct service provider organizations. Please do not include any letters of support because reviewers will not consider them. A letter of support describes general support of the project, while a letter of commitment outlines the contributions the organization will make in the project. The statement of certification is a written statement certifying that partnering service providers listed in the application meet the 2-year experience requirement and applicable licensing, accreditation, and certification requirements. Attachment 4 is the project timeline, which should show the major activities, milestones, timeframes for implementing the project. This attachment is scored by reviewers. Please provide a chart or a graph depicting a realistic timeline for the entire 5-year period. Please show dates, key activities, and responsible staff. And the key activities must include the requirements outlined in the required activities. Attachment 7 is the letter to the state point of contact. Applicants should include this letter as required and make sure it is prepared according to the instructions in the NOFO and application guide. Please review the attachment requirements carefully. Missing, incomplete, or incorrectly labeled attachments may affect the completeness of your application. Attachment 8 is proof of nonprofit status. Any of the following is acceptable evidence of nonprofit status: a reference to your organization listing in the IRS tax exempt site, a copy of a current or valid IRS tax exempt certificate, and a statement from the state taxing body. Attachment 11 is Form 170, assurance of compliance with SAMHSA charitable choice statutes and regulations. You must complete this form if your project is providing substance use prevention or treatment services. And lastly, attachment 12 is the quality improvement plan. The quality improvement plan is part of the application, which should describe how fidelity to evidence-based expert practices will be monitored and strengthened throughout the project period. The quality improvement plan must also outline fidelity standards, performance measures, and continuous quality improvement approaches. Upon award, recipients are expected to implement the approved quality improvement plan and update it annually, maintaining documentation for federal monitoring and reporting purposes. And now I will turn it over to my colleague Audine, who will provide an overview of the required and allowable activities in addition to data collection.
Good afternoon, everyone. I'm Audine Watson. I'm a project officer on the SBIRT team. I'm going to discuss the required activity screenings. Screen all participants for substance use, either using a full screen or a pre-screening followed by a full screen for those individuals who test positive on a pre-screen. Some pre-screening tools are such as CAGE or the DAST. Full screening tools for adolescents and drugs pertaining to children, adolescents, and adults can be found on pages 11 and 12 of the notice funding opportunity. After you do the screen, if the individual do come up positive for substance use or alcohol use, you may refer them to short course brief intervention, which is between 1 to 5 sessions, delivered with client-centered, non-judgmental, motivational interviewing techniques. The focus is on raising an individual's awareness of their substance use and motivating them towards behavioral change. The selected brief intervention approach must be described in Section B of the project narrative. For brief treatment, that can be up to 12 sessions. This includes the monitoring of individuals who misuse alcohol. Who misuse alcohol or drugs but have not yet developed a severe substance use disorder. This is a distinct intervention that consists of a limited course of highly focused clinical sessions. You may also refer the client to treatment for referral to treatment, provide case management and referral to specialty treatment sources, utilizing a warm handoff procedure for individuals who are identified as meeting these services. Applicants must include letters of commitment in attachment 1, demonstrating that if awarded, they can procure sufficient specialty substance use disorder treatment capacity for the projected number of individuals needing services. Upon award, memorandum of understanding agreement will be required as specified in the notice of award. The requirement for local specialty substance use treatment providers can be procured through contracts or other formal agreements to ensure individuals identified as needing treatment are accepted with minimal wait time supporting expert goals for treatment engagement and retention, and using realistic target projections to show timely access to appropriate care. You can also use treatment.gov as a helpful resource for finding treatment providers. Provide wraparound services addressing barriers to access to care, such as transportation to treatment, peer support, or recovery support services. Develop treatment protocols and plans for project assessment. And specialty treatments, services with or without medications as individually indicated, may include comprehensive assessment, outreach pre-treatment services, outpatient services, intensive outpatient services, residential services, and partial hospitalization, high intensity outpatient services, just to give you a few examples. Next, I will discuss the allowable activities. Allowable activities are not required, but you may propose to use funds for the following activities. Consider the communities that will be affected by this project and engage them in the overall program planning. You can screen for suicide risk, implement efforts to include expert practices into electronic health records or use of automated devices to enhance treatment. Develop and disseminate materials and best practices. Train healthcare providers on best practices. Assess for and respond to the needs of individuals for families served by the program who are at risk for experiencing homelessness. And one of the things I just would like to add as far as training healthcare providers on best practices is motivational interviewing is one of the best practices when screening individuals and they may not be quite ready for treatment. Other allowable activities is conduct on-site or by referral prevention, education, screening, and rapid testing for infectious disease associated with substance use disorder, including HIV, viral hepatitis B, and hepatitis C, bacterial sexual transmitted infections, STIs, including gonorrhea, chlamydia, and syphilis, and latent tuberculosis infection following clinical guidelines. Develop partnerships with other providers for service delivery and with stakeholders serving the population of focus. And this is the last slide on the allowable activities. Train, provide workforce development to help your staff or other providers in the community identify mental health or substance use issues or provide services consistent with the purpose of the program. Develop policy to support needed service system improvements. Implement, acquire, or upgrade health information technology. You must report the data in SAMHSA Performance Accountability and Reporting System using approved SAMHSA's performance measurement tools. You can visit SAMHSA's Performance Measures webpage to view the performance and measurement tools. Data and collection and reporting tools and guidance will be provided post-award. I will now turn it over to the Office of Financial Resources to provide a grants management overview. I'll turn it over to Victoire.
Good afternoon, and thank you again for participating in this pre-application webinar. My name is Victoire Bicoy, and I'm a grant management specialist with SAMHSA. I will be presenting the grant management overview of your application requirements. The information you will find on here will be helpful as you are walking through the application. So you should keep it handy as a point of reference. Next slide, please. On this slide, we will cover, this is actually what we will cover in this application. So we will go through the application the available resources, applicable policies and regulation factors affecting allowability of costs, budget narrative and justification, some sample budget templates, and we will talk about the Form SF424A. We will talk about the key personnel, the indirect cost rates, the funding limitations / restrictions, and you will get time to ask your questions. Next slide, please. So applying for a grant, this slide shows you all the resources that you have that are useful to apply for the grant. It link will send you to a specific knowledge to how to apply for the grant. Next slide, please. You must have an active account with SAMGov. This was already said by your program officer. So the first thing you have to do is to register, have an active account with SAMGov, and you must agree to the financial assistance, general certification, and presentation. Those for contract are different. Next slide, please. So once you're registered, you will have to maintain your registration throughout the life of any award. If your organization has multiple UEIs, use the one associated with your physical location. You must also have an active account with Grants.gov, and you can see step-by-step instruction in the Grants.gov Quick Start Guide for applicants. You must also have an active registration in ERA Commons. Register at least 6 weeks before the application deadline. And again, the link on how to register in ERA Commons is given, and you can go to section A to see all the application guides. Next slide. Administrative and national policy requirements. There are important rules you need to know if you get an award. You must follow all these below. All terms and conditions in the NOA. The NOA is the Notice of Award. We incorporate this NOFO by reference. You can see SAMHSA standard term and condition on our website. You must follow the regulations at 2 CFR Part 200. Uniform administrative requirements, cost principle and audit requirements for HSS, award, modifications, and 2 CFR 300, and any superseding regulations. So we strongly recommend that you get familiar with those regulations. The HSS grant policy statement. Your NOA will reference this document. If there are any exceptions to the GPS, you will be listed in they will be listed in your notice of award. All federal statutes and regulations relevant to federal financial assistance, including those highlighted in HHS administrative and national policy requirements, can be found in section 8 in this application guide. All anti-discrimination laws. By applying for or accepting federal funds from HSS, you certify compliance with all federal anti-discrimination laws and these requirements. Complying with those laws is a material condition of receiving federal funding stream. You are responsible for ensuring sub-recipients, contractors, and partners also comply. SAMHSA grants must align with SAMHSA and presidential priorities and policies. SAMHSA may terminate any award in accordance with any of the conditions set forth in 2 CFR 200 340 Part A 1 to 4, including when an award no longer effectuates program goals or agency priorities as provided in 2 CFR 200 340A4. Next slide. There are important rules you need to know if you get an award. You must follow the following. The rules list, and there is a link. All federal statute and regulation relevant to federal financial assistance, including those highlighted in HHS administrative and national policy requirements. Here you will go to section J in the application guideline. All activities proposed in your application and budget narrative must align with the current executive orders, SAMHSA strategy priority. All these are the link. You can click to learn more about the executive orders and SAMHSA strategic priorities. And where applicable, demonstrably advance the president's policy priorities. If an application does not align, the application will not receive funding. The current FY NOFO and applicable application guide. Next slide. Factor affecting allowability of cost. Proposed budgets must contain allowable, reasonable, and allocable costs as defined under 2 CFR 200, 403, 404, and 405. Allowable costs, unless otherwise authorized by program statute, are necessary and reasonable for award performance and allowable under the cost principle. Reasonable costs are not in excess of what would normally be incurred by a prudent person under the circumstances prevailing at the time the decision was made, given market rates, effort, and the organization documented policy. Allowable costs can be charged to a federal award if the goods or services are chargeable in accordance with relative benefits received. We are in the process of fully adopting 2 CFR 200. Additional information will be provided when that transition fully occurs. Follow the requirements in your NOFO for the application. Next. Okay, this is the second slide of factor affecting allowability of costs. All activities proposed in your application and budget narrative must align with the current executive orders, EOs, and SAMHSA strategy priorities. In addition, the application and budget narrative must not support harm reduction as outlined in SAMHSA Dear Colleague letter. Again, all those highlight, these are links. You can click on them to learn more about each of those requirements. Discretionary award shall not be used to fund, promote, encourage, subsidize, or facilitate racial preferences or other forms of racial discrimination by the recipient, including activities where race or intentional proxies for race will be used as a selection criterion for unemployment or program participation. Denied by the recipient or of the sex binary in humans, or the belief that sex is a chosen or mutable characteristic. illegal immigration or any other initiatives that compromise public safety or promote anti-American values. If an application does not align, the application will not receive funding. Funding restriction. So for this NOFO, these are the next couple of slides will tell you about what is restricted. Food is an allowable expense in conjunction with mental or substance use disorder treatment services. The amount cannot be more than $10 per client per day. Recipient must comply with all applicable federal anti-discrimination laws material to the government's payment decision for purpose of 31 U.S.C. 3729 Part B. Capitalizable infrastructure, such as computer, system, or software, is recoverable and depreciation through an approved negotiated indirect cost rate or 15%, the de minimis rate in accordance with your organization's existing capitalization/amortization policies. SBIRT/recovery housing is an allowable cost. However, funds must not be used to pay for non-recovery housing, housing application fees, or housing security deposit. SBIRT recovery housing must allow access to and use of U.S. Food and Drug Administration approved medication, including medication for opioid use disorders or alcohol use disorder. Funding restriction continues. Discretionary awards shall not be used to fund, promote, encourage, subsidize, or facilitate the following: racial preferences or other forms of racial discrimination by the recipient, including activities where race or international proxies for race will be used as a selection criterion for unemployment or program participation. Denial by the recipient of the sex binary inhuman or the belief that sex is a chosen or mutable characteristic. Illegal immigration or any other initiative that compromise public safety or promote anti-American value. Discretionary awards must not support harm reduction as outlined in SAMHSA Dear Colleague letters or on harm reduction. Discretionary awards must not support housing first. Policies that fail to ensure accountability and fail to promote treatment, recovery, and self-sufficiency. This is the last slide on funding restriction. Grant funds may not be used to purchase medication to treat HIV, HBV, HCV, or tuberculosis. Pre-exposure prophylaxis and post-exposure prophylaxis for HIV. You must also comply with SAMHSA standards for financial management, standard funding restriction, and principle in Section J in the application guide. All activities proposed in your application and budget narrative must align with the current executive orders, SAMHSA strategy priorities, and where applicable, demonstrably advance the President's policy priorities. If an application does not align, the application will not receive funding. Next slide. Now, budget narrative and budget justification. All applications must include a detailed budget and narrative justification that explain the federal and the non-federal expenditures. The detailed budget and narrative justification must be consistent with and support the project narrative. Your budget provides a description of existing resources and other support you expect to receive for the proposed project. Other support is defined as funds or resources, whether federal, non-federal, or institutional, in direct support of activities through fellowships, gifts, prizes, in-kind contributions, or non-federal means. The budget narrative and justification must be concrete and specific. It must provide a justification for the basis of each proposed cost in the budget and how that cost was calculated. Example to consider when justifying the basis of your estimates can be ongoing activities, market rates, quotation received from vendors, or historical record. I will stop here to emphasize that when you work on your budget and budget narrative, we don't want you to just, I will take an example. If you have supply line in your budget and your budget narrative, we don't want you to give a lump sum. You said like budgets, for instance, will be $10,000. We want you to be specific and give us the category of all the supplies that you will buy, the unit cost, and the quantities. So lump sum are not acceptable. So please keep that in mind and be mindful when you do your budget and budget narrative. Lump sum, I took an example of supplies, but it applies for all the other budget categories. Next slide, please. So detailed breakdown must be provided of the material, quantities, numbers of persons, cost per unit or hour, number of hours, level of effort, or other relevant basis to show how costs will be utilized towards achieving the grant's goals and objectives. This is to facilitate the determination of whether the proposed costs are allowable, reasonable, and allocable. The total for each budget category in your detailed budget with narrative justification must match the corresponding total of each object class category on your SF420A, Section B, budget category. So you will see the templates in the next slide. Your detailed budget with narrative justification should reflect the project cost for the first year only. In your budget summary table, you will show the amount requested for future years and justify/explain any change in amounts requested for future years from what were requested in year one. So an illustration for a budget and budget narrative justification is included in Appendix L of the NOFO. So you can have more detail. Sample budget templates. To reduce error and expedite the review of your budget, it is highly recommended to use the SAMHSA budget template that you can find it in the link that is below this slide. To complete the detailed budget and narrative justification required for submission with your application. Over the years, numerous recipients requested a template to present budget information. We heard you. The budget template was created with extensive recipient consultation and input and designed to avoid all the common budget preparation pitfalls. The SAMHSA budget template includes a wealth of helpful tools, tips, and resources to assist and guide you with preparation of your budget. The budget template is available on that link. So it's a very detailed template that is self-explanatory. For SAMHSA to review all your budget data, you must flatten, convert the PDF to a non-editable format by printing the PDF before submission. So in this side, you have all the resources to find your budget template and to learn how you can complete those forms. Next slide, please. Avoiding common issues with the SA 424A. Section D is forecasted cash needs, colon, total for first year, line 15. Total must equal section A, budget summary. Subsection, new or revised budget, colon, total J, line 5, total amount. Section B is the budget category, colon, total 5, line K totals, must equal section A, budget summary, subsection, new or revised budgets. And that should total colon line J and line 5, total amount. The number of years indicated in section E, budget estimates of federal funds. Subsection, future funding periods / bracket years must correlate with the number of years based on the start dates and end dates in section 17 proposed projects on the SF 424. Enter data for the first budget period in section D and enter future budget period in section E. Please refer to the notice of funding opportunity for additional guidance. So this is a sample of a 424A. This is the budget section. And on this project, your program does not have a match cost sharing. So in this form, you have section, you have all this column here where you have the budget categories, and you have section B, budget categories, you have all the amounts, and on section E, A, you have the total that should match the 200, like you see here, 200,047 should equal section E, should equal section A, and should equal section B total. Next slide. And this is the second page of the form SF 424. In here, we want you in section E in section D to do the projection of your cost by quarter. Let's say if your year one budget, total budget is 247,500, and then you have 4 quarters. So you divide that total budget by 4, and you will give all the forecasted cash needs for each quarter. And here you see that each quarter you need 61,875, and that is on section D. And in section E, we want the budget estimate of federal funds needed for the balance of the project. That means if your project is 4 years or 5 years, we will want you to give us the the budget that you forecast for each year. And here in this example here, the forecasted budget is 247,500 for all the 4 years. Next slide, please. Key personnel. Key personnel play a critical role in the effective implementation and management of your SAMHSA funded projects. Regardless of whether their salaries are covered by these grants, these individuals must have a meaningful role in carrying out the project and be actively engaged in oversight, reporting, and compliance throughout the duration of the project. On this project NOFO, there are 2 key personnel. The project director, we also say the PD. The PD is responsible for managing the grant to ensure that objectives are achieved. All reports are submitted on time and compliance with all regulation is maintained. The minimum required level of effort is 100% of a full-time equivalent. The second key personnel is the project evaluator. His role is to collect and analyze data to assess the effectiveness and impact of programs, projects, processes, or policies. This position requires a minimum level of 25%. If funding is awarded, you will be informed whether your proposed key personnel have been approved. Should your organization need to replace any key personnel during the project period, SAMHSA must review and approve the replacement based on their resume and job description. Identify the principal investigator, PI or PD has the contacts in section 8F and include their common ID in field number 4 of the form SF424. Only one individual, either the PD or the PI or the PD, may be designated as the contacts in ERA to perform actions and receive notification, not both. If the PD is a contractor or consultant, a formal written agreement must be provided outlining the official relationship and confirming their responsibility and all required duty and tasks. Indirect cost rates agreement. Ensure that you submit your organization current negotiated indirect costs, rates agreement, or cost allocation plan with HHS or any other federal agency which require to support the charge of indirect costs. If your organization is opting to use 15% of modified total direct costs or MTDC, then a clear statement must be made in your RDC narrative as follows. Example, XYZ organization elects to use the de minimis rate of 15% of modified total direct costs, MTDC. Ensure that you accurately calculate the MTDC base to which your RDC rate is applicable. Include calculation to show how you arrive at your RDC base and RDC total cost. This is very important. So we want to have in file a current, if you use a negotiated indirect cost agreement, we want to have the current one. And in your budget justification, when you come to line section indirect costs, We want you to show us how your base is calculated and how you apply your indirect costs. If you choose to apply the de minimis, you also have to justify and to explain that in your budget narrative. Next slide. Questions. If you are at the end, in this slide you have again all the links where you can get the support that you need for your application. Okay. Payment management system. This is PMS. This is the portal where you will submit at the end of your budget period, you are required to submit a federal financial report, and you will submit that report in PMS. So you need to make sure that you have access, whoever will be in charge, to submit the federal financial a report has access to PMS, and you have to request. These are the link where you can request access. And if you have any questions, there are also the link for the help desk that can help you navigate. And also, if you have any questions about PMS, the last link will show you your PMS accountant liaison with who you can communicate to facilitate the navigation in PMS.
Thank you, Victoire. That concludes our pre-application webinar for today. Thank you all for joining us this afternoon. As mentioned earlier, if you have any questions, please reach out to the resource mailbox and we will assist you further. Have a great day.
Thank you.